Membrane sweeps, stretch and sweeps, just a little sweep. What exactly is this and what are the potential consequences for you? A membrane sweep is a procedure where a midwife or a doctor will sweep a finger around and or within the opening of your cervix, which is the lowest part of your womb, in the hope that it will stimulate the uterus and bring on labour earlier than it might otherwise have begun. First things first, a membrane sweep is a form of induction. It may not be as invasive or involve drugs or many hours of monitoring, but its sole purpose is to bring on labour earlier than it might have spontaneously started. And I think this is one of the first things to consider when deciding whether or not to agree to or ask for a membrane sweep. Another key point is evaluating their efficacy. That is, do they do the job that they're actually intended to do? And the answer to this is maybe, sometimes, but we can't be totally sure because it's really hard to know whether if you go into labour following a stretch and sweep, it's because of the stretch and sweep, or because your body was ready to go into spontaneous labour anyway. The latest Cochrane review in February 2020 states that membrane sweeping may be effective in achieving a spontaneous onset of labour, but the evidence for this was of low certainty, so not exactly conclusive. And what are the consequences? Well, although some women and pregnant people find membrane sweeps a fairly harmless procedure, others do report light bleeding, sometimes discomfort, sometimes even pain. And another thing to note is that sometimes a sweep can trigger irregular contractions, which might continue for a number of days and interfere with your ability to sleep towards the end of your pregnancy. Other downsides are the risk of infection, which all vaginal examinations carry, and it's a relatively low risk, but definitely worth mentioning. Along with the fact that some people just find these examinations at best embarrassing and a bit uncomfortable, and at worst extremely triggering in terms of previous trauma. There is also the chance that the midwife or doctor may accidentally break your waters whilst performing this procedure. Now again, this is relatively uncommon, but it can happen, and due to the small risk of infection after your waters have been broken, you may find yourself on a conveyor belt of coercion towards a full induction of labour if your labour doesn't progress after your sweep, which of course it probably won't if your body wasn't ready to go into spontaneous labour. So all of this can be a little bit surprising or distressing, especially if it wasn't explained to you fully before you agreed to the procedure. So with all this in mind, why are they so common? Why are so many people having them? Well, sadly, it seems to be the case these days that many people are getting sweeps or even requesting sweeps in order to avoid more invasive forms of induction, such as cervical ripening or artificial rupture of membranes, or even syntocinon, the full induction of labour. As due dates loom and pressure from care providers mounts on agreeing to an induction for going post dates or over your estimated due date, it sort of seems like the easier option compared to the other proposals on the table. It's really important to state here that you have the right to decline any intervention that is suggested to you. Hospital policy is not law, and you always have the right to make the choices that are right for you and for your baby. The evidence does suggest that having a sweep can reduce the incidence of a formal induction of labour, but this really begs a bigger question as to why we're so obsessed with getting labour started in the first place. These mild interventions are becoming more and more routine, and for that reason becoming more and more normalised, which sort of leads to a glossing over of the downsides. We want to be building confidence in women and pregnant people's bodies, not undermining it. So informed consent must always be given, and make sure you've weighed up all the risks and benefits for your particular situation. It might be that a sweep is definitely the right path for you, or maybe you want a bit more time to weigh up your options, or perhaps you just simply want to wait for your baby to give your body its signal that it's ready to go into labour. Did you have a sweep? How did you find it? I'd love to hear from you in the comments. Thank you for watching. See you next time.